Yeah, large numbers of people are going without dental treatment, and some even report extracting their own teeth because they can't find an NHS dentist in their area. Surveys reveal that today.
Well, the Dentistry Watch survey of more than 5,000 people found widespread unhappiness among both patients and dentists despite recent government reforms. Well, Dr. Ogo Eze, who runs a private dental practice, is here. Good morning to you.
Good morning.
How easy would it be to find a dentist who actually finds the contracts to have been a good thing for the industry?
Very difficult at the moment. I think it definitely depends on the area you're looking at. I found that areas with a higher socio-economic deprivation, dentists there are really feeling the strain at the moment under the new contracts, whereas in contrast, areas such as, for example, at Minster, more affluent areas, a lady I spoke to, a dentist I spoke to who owns a practice there, is very happy with the system. It works for her because each patient doesn't seem to need as much treatment, therefore she's able to work quite well under the new system.
And presumably they don't see the charges in the same way as other people. They may just think, right, that's fine, I'm paying for my dentistry, I don't need a lot doing, so that's fine. What about those people that we've been hearing are having to pull out their own teeth?
Yeah, I think that's probably quite an extreme case, and I'd like to think that that doesn't speak for most patients, but I am aware that patients are very, very unhappy. Many patients are quite unhappy with the new system, complaining that they're unable to find an NHS dentist and they're having to convert to the private sector because in a lot of cases dentists have had to turn private. So it is difficult for them, and as far as the dentists are concerned, there's definitely very, very low morale amongst them at the moment. They're having to work within a new system which is very target driven. It's all about fulfilling quotas and points, and to be honest with you, it's almost as if there's less emphasis that's placed on patient care, which is a shame.
So what would you say to the Department of Health, who says, contrary to what has been found in this survey, that they see this as being a minority view?
I think there's a difference. I think it's important to speak to people who are on the ground, who are actually working within the system, speaking to patients that are having to experience these changes, and I think you'll find that there's a lot of unhappiness. The government did state that their reasons for implementing the changes was to increase access for patients to NHS dentistry, to provide a simpler payment structure, but I think you'll find that the reality is definitely quite different to that. As we've heard, patients are struggling to find NHS dentists, and also with the recent survey from the PPI Forum has revealed that over 50% of the patients don't understand the new payment structure, so I'm not too sure that they've met their objectives.
OK, well, thank you very much for coming in. Good to talk to you.